Welcome to Talking About Kids. I am your host, R. Bradley Snyder, researcher, activist, and co-author of the What Every Child Needs to Know series of board books for pre-readers. News about increases in adolescent suicides can seem overwhelming. So in this second mini summer vacation episode of Talking About Kids, I want to share a newly published paper on the topic because I think it offers something constructive that we, as people who care about kids, can do to help reverse this trend. So first, some statistics. For the last year that we have complete data, which is 2021, we know that there were 6.5 suicide deaths per 100,000 12 to 17-year-olds in this country. That's up from 4.4 deaths per 100,000 12 to 17-year-olds back in 2011. Now, if you're familiar at all with my views on this topic, you'll know that I also want to point out that while the suicide rate for adolescents has increased, the rate for people in their parents' cohort, namely 39 to 44-year-olds, has also increased. In fact, the rate is roughly 3 times as great as it is for adolescents. I mention that only because I believe that suicide is not an adolescent problem specifically, but rather a societal one. But back to the adolescents for just one moment. For every adolescent suicide, research indicates that there are between 50 to 100 attempts. And oftentimes, it's our ER rooms, our emergency rooms, that see these adolescents after an attempt. And of course, as you'd expect, the number of ER visits that are suicide-related has also really increased over the last decade, up from about 0.9% of all pediatric ER visits back in 2011 to 4.2% of all pediatric ER visits in 2020, roughly a 5-fold increase. We also know from some very good science that between 10 and 15% of all people seen in an emergency room visit will repeat a suicide attempt within 12 months following their discharge. And that's where this new study that I want to tell you about comes in. Just last month, Candace Hamel, Sinwan Basharat, and Melissa Severn published a report in the Canadian Journal of Health Technologies entitled Emergency Care Follow-up for Children and Adolescents with Suicide Attempts or Ideation. And what they found is, despite the growing prevalence of these visits, there are no evidence-based guidelines for how or when these patients get follow-up. We don't know if texts are more effective than phone calls, or if in-person visits are more effective than texts or phone calls. We don't know if it's best to reach out to these patients 24 hours after their discharge, 48 hours after their discharge, a week after their discharge. As a result, ERs in Canada and in the US are kind of doing their best guess based on guidelines that are in place for adults. So, something that we all can do to help reverse this trend of growing suicide numbers is to advocate for better science and for the creation of evidence-based guidelines for treating and following up with young people who visit ERs with suicide-related symptoms. Full-length Talking About Kids episodes return next week with an important examination of fentanyl in kids. You will not want to miss it. Our theme song is by The Senators. For more of their music, go to thesenatorsmusic.com. And remember, kids are young goats and young humans. And the difference is that young goats are easier to manage.